Skill number 20. Provide perineal care, Peri-Care for female. Supplies needed: 3 pairs of gloves, bath blanket, bed pad, 4 washcloths, 1 large towel to dry, 1 large towel for barrier, wash basin, and soap. Critical element steps: wash genital area moving from front to back while using a clean area of the washcloth for each stroke. Using clean washcloth, rinse soap from genital area moving from front to back while using clean area of the washcloth for each stroke. Wash my hands, gather my supplies. Knock, knock. Enter. Hello, my name is Anna. I'm a student CNA. May I please check your wristband? Hello, Ms. Smith. I'm here to assist you to wash your genital area. Is that okay? I'm gonna set my supplies on your table if that's all right with you. Fill your wash basin with water. Check the temperature and make sure that it is comfortable temperature, and ask the client to check as well. Would you like to check the temperature of the water and see if it's comfortable for you? Is that okay? Yes. Okay, I'm gonna close your curtain for your privacy and make sure your bed is locked. I'm going to raise your bed for my comfort level, and we'll also lower your head. Make sure the client is in a supine position with the head low. Now lower your rail. And cover the client. Okay, would you please hold on to the bath blanket? If they're not able to hold on, you could tuck in under the shoulders, the back of the shoulders, and lower the linens from underneath. Don't want to overexpose the body. Now, what you want to do with the bath blanket is make it into a diamond shape. To do that, you're going to hold on to one end, bring it to the chest, and then on the other end, the second one, you want to bring it to the side. And then the bottom, which is the opposite to the top, will be in between the legs below. And finally, the fourth one, which is opposite to the side, will be on that side. You want to bend the knees. And as you bend the knee, the end that is on this side to your side, you want to put that under the foot. That way you are keeping all the areas that you're not working with covered. Now bend your other knee, Miss Smith. And the opposite end, again, under the foot. Covered. You want to have enough slack in the middle. So on this end, you could flap it open and expose only the area that you are working with. Put on your clean gloves. Put the pad underneath the client. Could ask her to lift up her hips. Lift your hips up. Thank you. And put your towel nearby to dry at the end. You're going to grab first washcloth. Make sure it's wet. Make a mitten. You want to make sure the hand that is towards the head of the patient is free. Soap up the washcloth to wash. Open the labia. You're going to wash the center first, and you want to use different size of the washcloths as you wash. So get center first from clean to dirty. Opposite end of the washcloth, side of the and clean to dirty, top to down, clean to dirty. Once you're finished, you dispose of the washcloth in the dirty linen hamper, or at the foot of the bed you will have a plastic bag which you will verbalize is there and place it inside. Now you're ready to rinse. Again, wet the washcloth, holding it on the hand that is opposite to where the head of the patient is. Open the labia, wash the center first, clean to dirty, front to back, using different side of the washcloth, side, front to back. Again, different side of the washcloth, front to back. Dispose again the washcloth. Now you're ready to pad dry. Put your towel on your table. You may leave the pad underneath. Dispose of your gloves without contaminating yourself. Cover the client. Extend the legs, supporting. Put your bath blanket to its original position without overexposing. Now you are ready to turn the client away from you so you could wash the buttocks. Okay, Ms. Smith, we're gonna turn away from you. If you will, hold on to the rail. One hand on the shoulder, one hand on the hip. On a count of 3, 1, 2, 3. Put on your next set of gloves. Make sure your pad is underneath still. If you needed to, you could move it. Bring your towel nearby. Get your washcloth, wet it. Put soap. Now again, you're gonna clean from clean to dirty, front to back, but first you're gonna get the cheeks first. Going up, different side going up, and using different side of the washcloth, you will clean the center going up. Dispose of the washcloth in the dirty linen hamper. Now you're ready to rinse with your fourth washcloth that you have. Again, cheek using different side of the washcloth. Clean to dirty, going up, clean to dirty, open, center. Dispose of the washcloth in the plastic bag at the foot of the bed for your dirty linen. Pat dry. Dispose of your towel. And you're ready to dispose of the pad as well in your trash can. Remove your gloves without contaminating yourself. Return to patient in her original position, laying on their back. Okay, we're all done, Miss Smith. I'm gonna cover you up. Put the blanket over the client, over the bath blanket, and roll the bath blanket from underneath in order to prevent overexposure of the body. Remove the bath blanket. Dispose of it in the dirty linen hamper. If you have a plastic bag at the foot of the bed, you will place that in there, which you could verbalize there is one there, along with your towels. Okay, Ms. Smith, we're all done here. I'm going to put my rail up, lower you to a safe height, and get you comfortable. Here's your call light within your reach. Would you like me to open your curtain? Yes, I'll open it up. And make sure your bed is still locked. Here's your overhead table. I'm gonna clean my supplies. Put your third set of gloves on. Put your soap in its designated area. Rinse the wash basin and dry it with a paper towel. Put it in its designated area. Put your linen into the dirty linen hamper or the plastic bag that you have at the foot of the bed. Remove your gloves without contaminating yourself. Wash my hands and get rid of your linens. Report and record.